Thank you, Mr President. I rise to speak briefly in favour of the automated external defibrillators bill. It's quite a tongue twister, Mr President. But I rise to speak in favour of the bill on behalf of the Greens. And in so doing, I want to acknowledge the leadership of the Honourable Frank Pengello. In this regard, I recognise that the honourable member first introduced this bill into this place back in the agenda. It's certainly one that will save lives. In Australia, approximately 30,000 people experience cardiac arrest outside of a hospital, with only 9% of those surviving. Cardiac arrest can happen to anyone, and it's one of the biggest killers of Australians under the age of 50. According to the Heart Foundation, Mr President, without chest compressions and the use of a defibrillator, a person in cardiac arrest will not survive. Cardiac arrest can take less than 10 minutes to cause death. Sometimes an ambulance can take longer than that to arrive. And we know that that is the case here in our state as we continue to deal with the ramping crisis that both major political parties have overseen due to their failure to invest in our health sector. Access to defibrillators can be the difference between life and death. They're simple to use, and defibrillators do not give a shock unless required and provide guidance to the user through vocal prompts. They're safe, they're straightforward. Why shouldn't we ensure that they're available for use in the community? And I will say, Mr President, the Honourable Frank Pengello did bring into Parliament House recently some of these mobile devices and showed these to me in Parliament House. I was really impressed with the technology, and I can see that really has the potential to be used in lots of different settings, and also potentially reduces the cost for entities that are going to be required to install these. The bill will ensure that public buildings are fitted with an automated external defibrillator, and I'm sure that will result in saving more lives. My office has heard anecdotally of batteries of automated external defibrillators being stolen, and I understand that they can have significant resale value. Regular replacement due to theft could be a burden for community-owned organisations if they're required to have a functioning defibrillator available under the legislation. So we do hope that the community will support the government will support community-owned buildings such as local sporting groups in managing this cost. This is a matter that the Honourable Justin Hanson raised on behalf of the Labor Party in the last Parliament, and it is an important point and one that I hope that Labor will take up now that they're in government. We know that the Honourable Frank Pengello has amendments to this bill to remove the South Australian Police from requiring automatic external defibrillators, and I understand this is due to the financial implications of including SAPOL in the legislation. We support the amendments that set the commencement date to 2025 for public buildings and 2026 for private buildings. This allows time for organisations to forecast the expense in budgets and to prepare for the change in legislation. This is a significant change, and so the amendment being advanced by the honourable member makes sense. The bill has been widely supported by organisations including the Heart Foundation and the Ambulance Employees Association. And the Greens are also supportive of having automatic external defibrillators accessible in public spaces. If these devices are readily available in the situation of a cardiac arrest, then it will save lives.